Hello, everybody, once again here at the Only Use Studios. Dr. Patino in his office. Going to continue our discussion about men and mental health, and in particular, how do men with mental health issues, and of course, we all have it, just like we all have personal health issues, manage the stress associated with that? I know personally and professionally, and some of the people I hang out with, it tends to be a macho thing to not discuss feelings. One, two, if you have issues to swallow them down. And what I've noticed, at least, and I think you might concur here, Doctor, is that pops out later in aggressive behavior, violent behavior, destructive behavior, or a massive coronary of some sort. So what is the deal with men and the stress of mental health issues?
Well, last time we talked somewhat about men having some difficulty with communicating emotions, right? And the burden of masculine toxicity and the fact that men kind of have to carry the burden of being macho, right? I mean, most people look at that as something negative, but if you really try to be empathic to the man, that's his burden. And carrying that has consequences, right? And you just mentioned, aggression, domestic violence, alcoholism, drug abuse, and so on, right? I mean, let me give you an example. I was actually down south for the last few days, and I was talking to a friend of mine, and we're talking about stress, and how stress affects you, and so on. And we were talking about a third friend of ours, that I haven't seen for a while, right? And he was telling me, he says, you won't believe this. This guy's is a traditional hunter, masculine, in control. Nobody's gonna tell me what to do. So he says he's at a gun store, right? And he gets this really tight pain in his chest,
Hmm.
and, and he knew there was something not right with his heart. But instead of telling someone there that he was having this weak moment of pain, right? He decided to drive himself in his truck to the emergency room,
Wow.
right? And he walks into the emergency room on his own and he tells them, I think I'm having a heart attack. Well, there's nothing positive about doing that, because not only he could have died on his way to the emergency room, he could have killed somebody else,
Very much so.
right? So that is kind of an acute consequence of machismo, if you may, right? But one of the things that we don't pay a lot of attention to, and I just want to bring it to the attention of men in general, is the fact that for some reason women live longer than men. I mean, it doesn't matter what part of the world you go
Yeah,
into,
it's across the board, universal.
universal. So how come? How
And
come
and and
women?
isn't it significant, like 7 to 10 years longer?
Well, I mean, as an average, it's about 3 years, but
Okay.
in some societies, a lot longer than that. So there are a lot of studies about that, genetics, chromosomes, and so on. But there's one particular feature of men that has to do with aggression that is not as present in women. And we also know that women have a better immune system. Interestingly enough, women get ill more often than men,
Hmm.
but men die younger, right? Okay. So, are there any other possibilities here? And that's why I named this podcast Men and Stress. And that is because there are very few things in the biology of man that are as consistently damaging to your longevity than stress. So now we have been raised with the idea that we have to tolerate stress, right?
Oh, yeah.
That you have to be in control, you take whatever comes, and you never fault, right? You never say, I can't handle this. But there's got to be a way for us to identify our limits, because chronic stress has the same reaction of in the body that you have when you have inflammation. And we've talked about this before, the stress reaction of elevated cortisol for long periods of time creates a multitude, like a chain reaction in your body. The utilization of glucose goes down, insulin is not as effective, people start building bellies.
I'm very
Vis-
familiar with that. Actually,
you start
unfortunately,
you start developing visceral fat, right?
yeah. No
So
matter
all
how
of
much I work out, it's there.
exactly, because visceral fat requires that your body be de-stressed, both in terms of what you're eating, what you're drinking, hydration, exercise, good sleep. There's a multitude of things that come together. But we have to understand that learning to control our anger, our impulsivity, our reactiveness is as good for us as learning to exercise. It's as good for us as learning to manage relationships well, right? Because we tend to perpetuate these cycles of stress, right? Especially with those people who are the closest to us.
So, how does one, especially if I mean, if they have just general mental health issues versus a mental illness, I mean, is that just an additional, I guess, barrier or difficulty in managing that stuff? Because I mean, we've talked before. There's psychological factors where people learn different behavior patterns alike, and then there's the chemical issue that maybe not allow you to be as adaptive for that. So, what's the answer there?
Well, you see, there's nothing you can do to better yourself if you don't recognize that there is a problem, right? So, step number one is you have to listen to your body. You have to look yourself in the mirror. You have to listen to your partner, right? And not feel that everything that is coming your way is criticism, right? Maybe some people close to you have your best interests at hand. They want you to function better, to live longer, to feel better, right? So that requires that you listen, right? And that you listen to your body, you listen to your head, you listen to your partner, and then you say, well, maybe there's something else that I can do to help myself besides going in these strenuous diets and over exercising and getting out of the gym totally mad. And you go to the gym and then you go out to McDonald's and then you stop at the bar and you have a few drinks. So you need to understand that you need to get disciplined with yourself, right? And you need to be able to recognize those areas of your life that are stressing you, but you don't have control over. Right? There are a lot of techniques, but what I find most frustrating when I get men to see me or to see a therapist that is working with me is that it becomes extremely shameful for men to present themselves as being weak. It's like if like men think of going to the psychiatrist, the psychologist, the therapist as somebody put him in the middle of the street and getting them naked, right? And then now everybody's looking at you naked. Think of it, the feeling you get, that's a reaction I get when I start probing into their life and their feelings and how they react. And that requires some degree of understanding. I do find that men tend to have a lot easier time communicating with their partners, but at the same time, the partner is holding a secrets, okay, that make the partner very vulnerable to the man's anger,
Mm.
right? So it's kind of like a no-win situation for the partner because they say, I know you're hurting, but you don't want me to help you and you don't want me to tell anybody about it, right? Eventually, those cycles kind of break, and they break not because man wants help, but because the consequences are too severe um, for the man to cope with. Let me give you an example. Uh, your partner says, I don't want to be with you anymore. I'm walking away. And then you say, well, I'll do whatever it takes so you don't leave, right? Okay. That's an opportunity It's an opening of a small little door, right? That may help us get somewhere. Or the individual becomes so depressed that it becomes suicidal and ends up in a psychiatric hospital. Or the drinking gets so severe that an intervention is required from the family, and then that person needs to go to detox, and that's another opportunity. So we're frequently looking for opportunities to try to engage man into understanding that the mental health system is not the enemy, and is not a shame, should not be a shame provoking event, right?
Which seems pretty important because the things you just mentioned are all crises, right?
Exactly. The problem that happens frequently is that we are going from crisis to crisis to crisis, right? And in part is because probably half to more of the people in the mental health system itself are men.
Mm.
So I mean, the fact that you and I are men doesn't mean that we're perfect at managing our emotions or anger, right? We may have a little more understanding of it, right?
Oh, you do it way better than I do, for sure. But then
but
again,
but
you've been doing it for 33 years and are
exactly.
trained in this. I mean, most men have never even discussed how do you manage stuff. I mean, being a young man, it was like, okay, work out really hard, again, stay focused, smash some things every once in a while, have some beers, and move on. And that's pretty much the typical mentality. Occasionally, I think you've said in the past shows, you find a friend with whom you could be, your term, emotionally intimate, and guys get kind of freaked out about that. But you can speak honestly about your feelings, your stresses, and the like. Um, I know personally, I've had a couple of those people in my life. They're all dead. uh, yeah,
Yeah, but
straight
let me
up, they all
let,
died, including one last year. So it's an interesting thing. I mean, I've experienced it. I think most guys don't have it. Um, even Matt, my friend, the former NFL player,
Mhm.
he's a therapist now. He saw that it was difficult for guys to do that, so he thought if I went and do it, big macho, 6, 7 foot NFL player, maybe I can be of comfort to those guys. But he's still finding it a barrier.
Absolutely. I mean, let me give you an example. I'm sure that in your real job life, where you kind of deal with people in the self defense, guns, type of environment, you have to deal with a lot of people who are very superficial, who
Mm.
are not going to let you see any vulnerability, right? And that they can easily turn into um, impulsive anger, barriers of frustration that they don't let you get close. You can see it in their body posture, you can see it in their facial expression. On the other hand, you have also actually worked with people like special forces, who have had tremendous amounts of mindfulness training into how to cope and how to deal, not necessarily because they're being trained to deal with their manhood issues, but because they cannot allow those issues to interfere in the battlefield or in the decision making of life and death situations, right? That they have to, I mean, sometimes they may look almost like a psychiatrist, we look like neutral, like we don't have any emotion, like we're not reacting to anything. And it's not that we don't, it's that we're processing it differently,
Mm.
because if we become emotional ourselves, that's threatening to the person in front of us. So how do you perceive the limits of man in terms of taking the step, right, of doing something that long term is good for you, but you can't really get yourself to do it?
Yeah, another guys that you mentioned, one in particular, he's a former officer and the group guys, and also worked for JSOC. And he was said a very interesting thing to me. I said, when they test you guys, what are they looking for? He says, well, that's kind of a secret. He says, but I'll tell you, in my case, he says I didn't have the IQ they wanted. They wanted above 130. He says, but I had a very high EQ, the
Mhm.
emotion. I said, "Oh, interesting." He goes, "Yeah, and that allows me, like he said, he said as an ops boss there, he says to make decisions that were very, objective, regardless of the stress, regardless of the situation, and that was a huge benefit to that organization." And I think
Yeah.
men need to learn how to do that. But at the same time, in his case, he has a family, super nice guy. He says, I had to learn the other side. I learned how to be vulnerable. Got the support I needed, talk to the right people, and so he's got this really kind of interesting balance between the hardcore guy and the soft, really nice person. Very unique individual for sure.
Yeah, and we men tend to create these little tribes, if you may, of and we tend to maintain the tribes for a very long time. And it's very difficult for us to allow new people into the tribe. And you said something that uses a word that I just remind me of something is that the issue of vulnerability,
Mm,
right? How can we help men? How can we extend a hand to a man and say, how can I help you learn to be vulnerable without you feeling that you're losing anything, right? And I think that in part it's a process. It's something that we need to give ourselves to do over long periods of time, and we need to start with kids, with children, right? Because the message that we're delivering to little ones is that it is shameful to be vulnerable, that you always have to be in control. You always have to have a solution for the problem. And if you don't, you fight for it, right?
mm.
Whatever you're fighting for. But you never let somebody shame you. You never let somebody step over you, and that creates a mentality where men not only can become abusive, but may become retaliatory, meaning that when you have and we talked about bullying before, we have bullying situations with kids. We have two problems. We have the kid who's doing the bullying and the kid who's retaliating to the bullying, whether in passive or active ways, right?
So, how would a man? Okay, you're talking about how we're inculcating the children as we're growing up, but a man now in our society, and God, in particular, our state, like you said, where I work, it's macho central, but really it's insecurity central. And there's this masquerading the macho. Where do they start? I mean, by talking to a friend, their spouse. If they're not comfortable talking to their spouse, because in many times, I know you and I were chatting about some things, the spouse might be the issue itself, part of it, and very uncomfortable to do that. Where does a man go for that kind of help?
Let me tell you something that I think that we don't have as much anymore. In the old days, and for me, the old days is the 1960s and 70s, right? Uh, Maybe a little bit of the 80s. Uh, for my kids, the 1990s is all times. But anyhow, there used to be a time when the family doctor was the center of the health universe of a family in general. And I'm not looking for 1950s pretty picture type of thing. But there was a role of the family doctor, the community physician, right? That stayed in one place for a very long time. And people would go and talk to this doctor about all their problems.
Mm,
There were not a lot of psychiatrists and psychologists, and we're talking about small, mid-sized, large cities. Um, and I can tell you that because my father was one of those physicians, right? Was a family physician. And I remember people coming to the house and knocking at the door and coming to the living room and sitting down with my dad, and my dad will talk to them. And when we started moving away from the concept of a centralized family medicine environment, we started losing the ability of men to at least have somebody to talk to, right? The doctor was part of the community. The guy will go to the bar and the doctor maybe is having a beer there too. Okay. That doesn't happen anymore. So what has happened over the last 30 or 40 years is that we have lost opportunities to identify who needs help. Why is that? Because today the family doctor visit as an average lasts 6 minutes. Okay. So how much can you get to know about your patient in 6 minutes? Very little. The idea of people going to the family doctor and saying, I'm not getting along with my wife, we're arguing a lot, requires that somebody sits down and listens to them,
mm.
right? So it's not an issue that we can just keep blaming men that men doesn't want to do it, but we have moved away from the available resources for men to be able to say the question you ask, where do I go? Right? I mean, you and I have talked before about utilizing social media as a mean of communicating with men for them to at least have a way to have some questions answered, right?
Mm.
Instead of having to go straight to see a psychologist or a therapist, we talk about having questions sent to the podcast so we can start communicating with people and start directing them. Try to suit some of their fears. Um, but part of the problem is that um, last time we talked about the burden of machismo, the burden of toxic masculinity, and it's a burden because what we're hearing from the rest of society is that you are bad. You need to be isolated. You should not be part of this, whatever this is, right? Because you're too toxic. And the problem is that just corners men into a small little place where the only thing you can do is to be miserable together,
Mm.
right?
Yeah.
And I
Yeah,
and I
and, you see those groups in the movies and stuff where the guys are getting together, and that's always what it seems like. It's a bunch of guys commiserating, but not actually moving forward, discussing anything of substance other than their pain,
well, I think that what
which may
is
be a
happening.
first step, but you need
Well,
something more than that.
one of the things that comes up often in my business is that we always we're always searching for purpose, right? I mean, I really think that some of the newer generations have gotten lost on the question of purpose. But one of the first things that you asked me what man needs to do, man needs to question, what am I doing this for?
Mm.
I mean, what am I arguing with my partner for? Okay. Why am I getting drunk for? Because in everything we do has to have a purpose. And I have a very close friend of mine who always gets mad when I say that, right? And he says, well, what about you having a good time? Well, that's purpose.
Yeah, de-stressing, whatever. Yeah.
Exactly. So we have to have purpose so we can move forward, right? I mean, it is almost um, fearful for men today to be a gentleman, right? Because men has been pushed so much into the concept of, well, you men are all toxic, that the idea of being a gentleman looks like weakness, right?
Oh, I deal with that a lot.
So um, toxic masculinity becomes a huge bubble of misery in which men are getting afraid of walking out of, right? Because all you hear is you're bad. Now, there are issues related to aggression that are more common in men. There are issues related to hunting that are more common to men. Uh, there are issues in some men that is difficult for them to socialize in certain settings and rather be alone. There's a lot of that, but the reality is that we have to be empathic to the suffering of men. And that, I mean, women always say that what's wrong with you? You
Mm.
must be crazy, right? I mean, because all the men hear is that you are the problem. So what I really like to ask men if, is how can we be the solution, right? How can we find purpose in a solution without having to sacrifice your history, your culture, your sense of value for your manhood if you want? I don't have a problem with that. I have a problem with the consequence of not doing it in a gentleman way, right? The problem that I have is that I have to deal with the consequences of that. Abused children, beaten woman, substance abuse. I mean, I just finished a meeting with a patient a few minutes ago, and we were talking about her issues, and we ended up talking about how the depression is getting worse because her estranged father just died from a fentanyl overdose, right?
Mm.
I mean, there's a lot. I mean, when we think about the consequences of what we do, we have to remind ourselves that we're dealing with issues of society, not issues of individuals. And as a society, each individual has some responsibility for maintaining communication, harmony, and peace, right? We cannot have long term purpose on anything if all we know what to do is fight with each other.
Mm. So really, you talk about the archetype of the man taking care of business for society, for their country, for their family. That becomes a primary issue, and really, taking care of their mental health is forefront in that.
Well, you see, there's part of the macho attitude that is very romantic, right? Like, I will die for my country. I will die for my family. I would die. And we actually grow up with this idea, right?
Mm.
And I don't think there's anything wrong with the idea, but we really need to get to understand what it means. It doesn't mean that you we want to die. It means that we want to commit to a purpose for our existence, right? We're trying to define what's important to us. So carrying a flag and saying "I will die for my country" means very little. It sounds very romantic,
So it really should
right?
be I want to live for my family. I want to live for my
Exactly.
country. I want to live for my community and provide some type of feedback. I have another question for you. What happens to men? And I just again, it's personal. I'm kind of one of them. Like I say, my close friends, the people I talk to, have all passed. One just passed last year. I'm the one everyone comes to for advice. The guy who passed is one of three people in my entire life who ever asked me, "How are you doing?"
Hmm.
Everybody else is coming to ask for their problems, but no one ever. And that's one of the. It was a very tough loss for me because I'm like, there's one of the few people who actually said, "How are you doing? Let's talk about you. What's bothering you." Everybody else the other way around, and I know that's your profession. I wonder about that with you. Who do you talk to for your issues?
Besides myself,
Yeah.
well, I have wonderful dialogues with me. It's very interesting because I find very soothing the understanding of others.
Hmm.
So for me, being able to connect and to understand where those feelings are coming from uh, teaches me as much about me as about them, right? So it's not that we're bootlegging therapy with our patients. It's just that the process of empathy and understanding is very self-fulfilling, if you may, right? So, but that doesn't mean that when somebody asks me, and I have some very close friends that are almost brothers for me, that they will ask me, okay, so how are you doing? Because I have had difficult times in my life.
Hmm.
I have made mistakes. I've done things that I shouldn't have done, like any human being, and I have had to correct and accept and change, right? And then they will come and ask me, "So how are you coping? How are you handling it?" You know. What I had to learn though is to just stop saying fine and move on, right? Because that's why it becomes difficult with men in particular, because men, the first thing they will tell you, how are you doing? Oh, I'm doing great,
Hmm.
right?
I'm
And
pretty sure.
it's
I'm
about
pretty sure. I'm pretty sure we literally did that just before the show.
exactly. Yeah,
And
but
so you
we had a little conversation after that, and it didn't end up.
afterwards, though. But initially, it's I'm fine. Let's go.
Yeah, so I mean, for me, when somebody tells me I'm fine, let's move on.
That's a red
Basically,
flag, then.
I don't want to talk about my problems. That's a red flag. So those are kinds of things that we're looking for. But back to men in particular, I just want to remind men of the senseless romanticism of machismo, right? I mean, and this is something I learned from my dad. And I didn't learn in psychiatry. He used to tell me, son, I don't like heroes. I was like, hey, dad, how come you don't like heroes? He says, because they're all dead. right? I like the smart people who stay alive and gives us something, and it gives us a legacy and it keeps us going, right? So we need to start finding ways to get people out of the misery bubble, right? And try to connect with them. So we're going to come up with some tools and try to get people connected so we can have some good ideas from men themselves, right?
Mm.
In terms of how
Well,
can we be healthy, not because we want to be better men, but because we want to live longer.
yeah, maybe it's getting out of your machismo bubble and really looking at yourself as a real human being, taking those steps instead of, like I said, waving the flag saying I'm willing to die for something. Let's talk about what we're willing to live for, what we're willing to contribute, and to make the world a little bit of a better place.
Yeah, I was, let me tell you, because I was in the airport last night in Houston, and I was sitting, looking at my phone because our flight got quite a bit delayed, and there were two guys in front of me, and they wouldn't stop talking, right? And then they started talking to other people. I didn't engage in the conversation. I wasn't interested in the conversation, but I'm always listening. And these two guys were MMA fighters, right?
Mm.
And one of them was very insightful, and the other one was very loud, and he wouldn't stop talking, and very foul language, in an airport place. And I said, you can see a kid who is the one who was very quiet, was very well trained in martial arts. He learned something, right? He doesn't need people to know who he is to feel calm and at ease with himself. And the other guy looked terribly insecure,
Mm.
right? I mean, and it was, I mean, I was there, my wife was there. I wasn't going to get into, I avoid those types of situations because it's not the right place to do anything, right? But it was obvious that people around this guy were feeling uncomfortable, moving away, things like that. But we can see the contrast, and that reminded me that there are people out there who are doing the right thing.
Mm.
There are men out there who don't have a need to utilize their machismo as a way of demonstrating that they belong, right? And that balance is what we want to achieve. And we actually need more of those men to come out and say, hey, I'm here too, right? I mean, is the big silent majority, right?
Mm.
Which is what we lacking right now is those people to speak up.
Well, hopefully we inspired some people to do that tonight with the things we've chatted with. Again, guys, everybody like, subscribe, and share. And if you want us to continue to speak on this subject, please let us know. Very interested to see what you guys have. We had some great traction on some of these most recent shows. That's why we're continuing the theme. But really want to have your interaction. And at minimum, we'll see you again next week, right?
Hey, thank you very much, Vince, and we'll see you next week. Take care.
Take care.